Next 21 for the effective communication, we have you are clerking a young child in emergency who has been admitted with the suspected bronchitis. Physical examination is remarkable except for the moderate wheeze. Although you note that the parents appear somewhat unkept with dirty hands and clothes, you considered what to document as a part of your finding in the medical note. So in this situation, you are just seeing a patient with suspected bronchitis, and the meanwhile you saw that the the patient's parents is somewhat unkept, and you're thinking what to write in the notes. So the important thing is trying when you ever trying to solve the SJT problem, trying to find out what the problem is. If you are able to find this, you just able to solve the question. So in this question, the problem is you want to write a medical notes. So in the situation, you should write, and all the situation where you write is the better one, and all the situation in which you just skip that is obviously poor one. So options are your opinions of the parents' treatment of the child based on your parents, detailed physical examination, objective clinical assessment of the child, a brief summary of the child clinical assessment, complete your notes after they have been confirmed by the senior, complete your notes later on after getting through a few more patients to keep on clinic moving. So pause the video and mark your answers. So answers are the best answer, as I said, you should write the notes. So the best answer in this situation is B. You should write the detailed physical examination and objective clinical assessment of the child. And the worst option is your opinion of the parents' treatment of the child based on their appearance. So obviously you cannot be biased or uh, just have your opinion regarding the appearance. So this is the worst kind of the thing being a doctor you can do. And anyone to write in this kind of the in the medical notes. So A is a worst, and obviously B is a best one. The second better one is C, a brief clinical summary of your clinical assessment. So in this way, you just doing the task of the question, which is writing the notes. So why it is better than the third one is E. Complete your notes later on after getting through a few more patients to keep on moving the clinic. So in this situation, as you are in the emergency department, so you should keep the mind the where the setting is. So important is you are in emergency department. So trying to do the things together rather than just leaving the later and just forget the findings. So better to complete the assessment and make the notes correct in the same time while you're in the emergency department. So B, C, E, and the left one is D, which will become your fourth one. Complete your notes after they have been confirmed by the senior. As an FY1 even, you have to fill your own notes, and it is not shouldn't be need to confirm by the seniors. So that is not make sense. You just leave the note for the confirmation by the senior. This is the wrong practice in the NHS. So you should do whatever finding you find and make your own notes in the NHS medical record. So this is your 21, and the final order becomes B, C, E, D, A. Okay. So you are working as a only junior doctor from the orthogeriatric team assessing a patient who had a fall. You are briefed by the nurse on another ward about one of your outliers who has become febrile. While you taking while you are taking his call, your crash bleeps start to sound. So this is a situation the multiple tasks just happen suddenly. It's just like you are just seeing one patient who had a fall, and you are just bleeped by the nurse to see a one patient who become a febrile, and just suddenly bleep a crash thing. So this is the thing you how you manage the situation by just effective communication. So the options are document your current assessment of the patient who has fallen and then attend your other commitments, attend the crash call and then return to write in the notes and retrospectively for the fallen patient, attend the crash course and then see the paraxial patient before documenting your assessment of the patient who fell. Avoid documenting the fallen patient as you are likely to be distracted by other tasks after attending the crash call and seeing the paraxial patient. Allow other members of crash to attend the rest call while you complete your documentation. So try to keep in mind the order of severity, patient safety, and urgency of a situation, and rank the rank the options. So 1, 2, 3, pause the video and mark your answers. So the best answer is understandable. The most urgent thing you need to address is crash bleep, right? So the best thing is in this option is C. Attend the crash call and then see the paraxial patient before documenting the assessment. So in this situation, in the option number 3, you're doing everything and also in the correct order. You attend the crash call and then see the sick patient and then document the patient which you have already seen. So C is the best one, and the worst one in this case is E, that we're just ignoring the crash call team. So that is the worst thing. Allow other members of crash team to attend the arrest while you complete the documentation. So this is the worst thing to skipping the crab bleep and when you're on call as well. E is the worst one and C is the best one. And the second better one is B. As I told you, B also you're attending the crash call and then try to assess in the note retrospectively for the fallen patient. So in this situation, in both you're just attending the crash call, right? And obviously you're just coming back and complete the task of documentation. And the third one is D, right? Third one is D, avoid documenting the fallen patient as you like to be distracted. So in why this is worse than the option number B, the reason is that in this situation you are not documenting the notes of the fallen patient. So it is your duty to document what you have been observed with the patient. So this is just like you are skipping the no skipping the documentation, though you are attending the crash call and also seeing the paraxial patient, but you're just skipping the uh, documentation. So that is why the D is worse than B. And the fourth one, obviously, your A. Document your current assessment of the patient who has fallen and then. So in this way, you're delaying the most urgent part. So that is the wrong thing. Okay. Next one is 23. You are working alone in the afternoon on your colorectal ward as an FY1 doctor being shadowed by the final year medical student. The nurse inform you that patient is looking increasingly unwell. A peripheral cannula needs to site for the blood transfusion and other patient's family wishes to speak with you in private. So here is again the situation is you are with one of the with final year medical student and they just different jobs bombarded on you. One is just nurse asks you to see one patient who need a cannula, and also another patient patient's family who wishes to speak to you. So the best thing is how you manage collectively everything. So options are select the best three. Assess the annual patient alone. Assess the annual patient with the medical student. Ask the medical student to assess the patient alone and join him as soon as possible. Ask the student whether he wishes to try to place the peripheral cannula. Attempt to insert the peripheral cannula yourself. Speak to the patient's family with the nurse present. Speak along with the patient family. Ask the student whether he would be comfortable speaking to the family. So pause the video and mark your answers. For the question number 23 is B, D, and F. B, D, and F. So the reason here is obviously A is when the medical student is with you and is also shadowing you. So it's better to just accompany with him for his clinical experience. And the next one is yes, the medical student can do the minor procedures like peripheral cannulas. We just also see in the one of the question the medical student is doing the catheter, so medical student can do the IV cannula, and also you just trying to talk to the patient family with the nurse present. So in the combined you're just trying to solve everything by this all three combined. Okay, so the next one is 24. You are working in a emergency department. Nurse inform you a 33-year pregnant lady is brought by the helicopter into the resuscitation. Followed a road traffic collision. She asks you to prepare for arrival in approximately 5 minutes. Your registrar has been informed and he asks you to call for assistance while he believes the obstetric team. So, situation is there. One of the pregnant women who has been coming from the helicopter into the resuscitation, she had some kind of rod collision. So important thing is you need to see the last three lines of the questions. So what this thing has done and what you need to do. One thing that your registrar has been informed and he is asked you to call for further assistance, and he himself is going to leave the obstetric team. So you need to find out what more help you need when your medical registrar and ops teams are already fine, and what else help you should need. So the options are: inform the neonatal registrar, call the orthopedic consultant at home, fast leave the hematology registrar, summon the cardiac arrest team, request a phototherapy, call the switchboard and ask them to put on a trauma call, ask the nurse to find a neonatal incubator and bring it to the resuscitation, ensure that there are medical students present to maximize the learning opportunity. So pause the video and mark your answers. So the best answers are in this situation is A, F, and G. So here in this situation, obviously, the obstetric team has already been called. You need to find something for the baby. So you are informing the neonatal registrar as the baby may be delivered in the resuscitation rooms. You need to ask the nurse for neonatal incubator and bring it to the resuscitation team. And also, the best thing is to put the call for the trauma. In this situation, there is no as such mentioning of cardiac arrest yet. You need a resuscitation team, and when you're putting on the call for the trauma team, so there are the people who just want to deal with the trauma better, and there is no as such mentioning of the arrest. So in this situation, that is why D is not an option rather than F. 25. You're working on a call and you're asked to cannulate a large patient who require an intravenous antibiotic for suspected diarrheal infection. Your beliefs sound for third time during your fourth cannula attempt when you finally believe that you have been obtained assessed. So situation is this, as always you are on call and you are just cannulating one patient and it's your fourth turn, right? And your bleep has been ranked third time, but this time you know it's just like you are in a situation that you're just almost finishing your cannula and your bleep is just begin to rank. So what you should do in this situation? So options are: stop your attempt immediately and answer your bleep, secure and flush the cannula before answering your bleep, try to get attention of the ward sister so that she can answer your bleep after securing and flushing the cannula, cleaning the area and saying goodbye to the patient, ignore the bleep as they will call it again if it's important. So pause the video and mark the answers. So the best answers in this case is B. Obviously, you are just on spot, and this is your fourth attempt. So you just finish your cannula and just trying to answer your bleep. So in this option, you are just trying to do the both thing in a good manner. So B is the best answer, and worst answer in this situation is A. Right? You just if you just immediately stop the your cannula attempt, you just miss that attempt as well. And you've already attempted three times before. So better is just to complete the almost completed uh, cannula. So A is the worst one. It's just to stop the cannulation is not the solution here for this situation. So best one is B and the worst one is A. The second better one is C. Obviously, you're just trying to do both things. So in this situation, trying to get an help from the ward sister as she can answer your bleep and just meanwhile just complete the cannula. And the next one is D. Answer your bleep after securing, flushing the cannula, cleaning the work area. So in this situation, there is a little delay. You're just completely doing everything and just delaying the bleep answer. So that is why D is worse than the C. And obviously left with E, ignore the bleep and they will. So you cannot ignore the bleep. This is a wrong answer. Okay. So this is the question number 25. So final order become B, C, D, E, A.
A patient on your ward is diagnosed with anal cancer. He tells you that his community would react very negatively if they knew of his diagnosis. As a result, he is very anxious that no one finds out, including his family. Okay, so this is a kind of question in which a patient wants to keep his information as confidential, which is all obviously right of a patient. Okay. Um, Now we're going to rank the answers. We should keep it in mind that his confidentiality should be protected, but this confidentiality should not risk his um, future. Like someone or other doctors need to know about his diagnosis. Okay, so we should keep this in mind too, along with the confidentiality thing. Okay, so what are the options? Promise to remove any mention of anal cancer from his notes. Tell the patient that you will remove any mention of his diagnosis from patient list. Tell the patient that his family are bound to find out at some point and it would be better if you told them. Let the nursing staff know that his family are not aware of the diagnosis. Treat him as any other patient under your care. Pause the video and mark your answers. Okay. So the best one among these is B. Tell the patient that we will remove any mention of diagnosis from the patient's list. Okay. So best one is B. Like we are protecting his confidentiality. We will remove his mention of his diagnosis from the patient list. Okay. And the worst one among these is A. Promise to remove any mention of anal cancer from his notes. Okay, if we remove any mention of anal cancer, then in future, if we had some problem or something like that, then some problem or aggravation of this anal cancer, then if his diagnosis is being removed from the notes, other doctors wouldn't be able to have an access to the real diagnosis. Okay, so we don't want to do this. Like we don't want to risk his future. That's why we are not removing it from his notes. We are just removing from the patient list, which is at present, and it will be hidden from other family members or other patients, but not from the doctors. So B is the best one, and A is the worst. Okay. Now we'll rank the other three, C, D, and E. Among these, the best one is D. Let the nursing staff know that his family are not aware of the diagnosis. In this, we are not hiding it from our doctors or medical staff or nurses. We are just informing them that the patient doesn't want other patients or his family members to know about his diagnosis. So it's a partially right answer. Okay. Other two are among the C and E. E is the best one. Treat him as any other patient under your care. It's kind of a neutral question. Like in this, we are saying that we are just treating him like any other patient without any judgment or any um, being partial or being different to the patient. So it's a kind of neutral statement. So E is on the third place. And on fourth place is C. Tell the patient that his family are bound to find out at some point, and it would be better if we told them. In this, we are persuading the patient to um, tell his diagnosis to his family, which is not right. It is the right of the patient to protect his confidentiality, and if he doesn't want his family to know about his diagnosis, we
You
are not
shouldn't.
bound to persuade him. Okay. Next one is you hear Karen, one of the nurses, speaking unpleasantly to a child on the pediatric ward. The child is known to be particularly challenging to work with as he has a history of learning difficulty and behavior problems.
Mm.
Okay. So here the problem is that a nurse is being rude with the child who is having a history of learning difficulties and behavioral problems. Okay. So what should we do in such situation? Let's read the options. A is approach the pair and ask to speak to Karen. Speak to the senior nurse before approaching Karen. Ask other staff working on the ward whether they have noticed any appropriate behavior recently. Do not raise any concern as the child is not at risk. Inform the hospital trust. Okay, now pause the video and mark the answers. Okay, so one thing that we need to keep in mind is that even if a patient has learning difficulty or any other mental disorder or any problem, he should not be treated differently. So the he should be treated with the same care as any other patient. So the best one among these is A. Approach the parent, ask to speak to Karen. In this, we are immediately resolving the issue. We are like he is currently speaking unpleasantly to the patient. We are jumping in the conversation and asking him to just stop being rude. Okay, approach the pair and ask to speak to Karen. Okay, and this is the best one. And the worst among these is as we have discussed before that we should not treat patients differently if they have any mental disorder and learning difficulties. So even the child is not at risk, but being indifferent to the child or being rude to the child is wrong. So do not raise. D is the worst one. Do not
Right.
raise any
Mm.
concern. Like we are doing nothing.
Yeah.
Okay, so it's not right.
Ah.
Okay, do not raise any concern as the child is not at risk. Obviously, is not at risk, but being rude is not good. So that's why we should raise the concern. So do not raise the concern is wrong here. A is
Mm.
the best one, D is the worst. We are left with BCE. Okay, B could be an approach that we are not directly telling the nurse. We are moving through the hierarchy. We are telling the senior nurse first and then approaching the uh, junior nurse Karen. Okay,
Mm,
but in this situation, obviously, best one is to speak to him directly. That's why A was better than B. B is on the second place, and then on the third place we have C. In C, we are just asking the opinion of other staff members that whether they have noticed the same behavior from Karen. So C is just being neutral but not solving anything. Okay.
mhm,
C is on the third place, and then E inform the hospital trust. This is a matter which could be solved within the team, within the ward. So no need to jump to such a big hierarchy that is telling the hospital trust. It's not required here. That's why it's not second last place. So the order becomes A, B, C, E, D. Okay. A patient who was admitted for an exacerbation of COPD is upset about the standard of care she has received over the weekend. She would like to speak with you about the possibility of making a complaint. Problem here is this: uh, a patient with exacerbation of COPD is upset because he thinks that he has not received adequate amount of care over the weekend. So he's like making a he
complaint.
wants to make a complaint and he's discussing this issue with you. So what you're going to do? Suggest that making a formal complaint is unlikely to resolve the situation. Provide contact details. Pals what they can offer. Discuss what happens over the weekend to upset her. Inform your consultant that the patient is considering making a complaint. Inform the patient that weekend medical cover is often inadequate and that a formal complaint might help to improve staffing levels. Okay. So a patient is being concerned because of the amount of care he received over the weekend. So we need to just explore more. As we know that exploring is always the best option in such cases. Okay. So C is discuss what happened over the weekend to upset her. This seems inappropriate to upset her, but um exploring is anyways always the best one. So that's why C is the best here. Discuss what happened over the weekend to upset her. And the worst one is E. We know that we should not, like if we are working in one department or in one shift, we should not backbite or complain about the other shift ourselves. Okay,
mhm.
patient can complain, but we can't like jump into the complaining side. Okay, like inform the patient that weekend where medical coverage is often inadequate. In this, we are kind of gossiping about our uh, other shift doctors, like they are obviously they are being like we are just complaining about the other. So that's why it's not our duty. A patient can complain but we can't like
You.
burn the fuel to the fire. Okay, so that's why inform the patient that weekend medical cover is often inadequate and that a formal complaint might help to improve staffing level. It's the worst. So we are left with the other options, which is B, A, B, and D. So B is the best among these. Whenever a patient complains, we should tell him about the pulse. Pulse often resolve such issues and make the situations more clear. And this is always good to inform PAL if patient to offer pulse patient to the patients if they have any complaint. Okay. So B is on the second place and D is on the third place. Inform your consultant. In this, we are telling the consultant that patient is having a complaint. Maybe consultant talk to the patient and issue might be resolved. So that's why D is on the third place. And
Yeah.
on the second last place, we have A. Suggest that making a formal complaint is unlikely to resolve the issue. Yeah, it's also not good to discourage the patient whenever he have such complaints. Okay, so in A we are discouraging, so it's also among the worst one. But
Mm.
E is more worse than
We're just also
A.
involving in the complaint.
Yeah, that we ourselves are like gossiping about our teams. That's why it's not good. Okay,
Okay,
so the order becomes CBDAE.
good.
You are being shadowed by a medical student during a long day in E&D. The student is very keen to help with procedures and you ask him to catheterize Mr. Wills. When you enter the room, the urinary catheter is partially inserted, but you realize that you have directed the student to the wrong patient. Okay. So this is the situation in which we have told a medical student to catheterize a patient, but as soon as we see him or observe him catheterizing, we immediately realizes that we have given him the directed him to the wrong patient. So it's a kind of mistake of both of us, like the doctor who is asking the medical student to catheterize, and also it's the mistake of medical student that he has not cross checked that which patient is being is going to be catheterized. Okay, so it's a mistake of both parties. So there are options what we are going to do. We have to choose about we have to choose the three appropriate which solve the issue. Okay, so the first one is ask the student to stop catheterizing the patient immediately. Write a clinical incident form. Tell the student that he should go home as he should have checked the patient wristband. Allow the student to continue inserting the catheter in case it is necessary anyway. Allow the student to insert the catheter but take it out afterwards before telling the patient it was to obtain a clean urine sample. Ask the student to apologize to Mr. Will, accept full responsibility for the error, obtain an ultrasound, KUB. Okay, pause the video and mark your answer. Okay, the first two are quite clear that they are the right one. Like we are immediately stopping the student who is catheterizing. It's very obvious that it's the right one, that we have found the mistake and we are immediately trying to resolve it. Okay, and these clinical incident forms, it is also an obvious right answer, that whenever such kind of mistakes or errors happen, we usually fill the incident form to make it a record so that this doesn't happen in the future. Okay, yeah, and we are the best. So and the third one is F.
Yeah.
Yeah, we are telling the student to apologize. We can't take the full responsibility for the error because it's the mistake of both of us. So student should also apologize. Also, if there is option that both you and the student apologize, then it would be the best one. But it's not present here, so ask the student to apologize is somewhat better. Okay. Your registrar asks you to consent a patient whom you have clerked in A&E for a scrotal exploration with possible archidectomy. He is unable to consent the patient if he is in the emergency theater with the patient already in the anesthetic room. Okay. So here the problem is that you have that your registrar tells you to consent a patient for scrotal exploration with possible orchidectomy. Okay. Uh, he's telling you because he can't consent. He's because he's busy in the anesthesia room. But as we have discussed before, that we as FY1 are not supposed to do the consent thing because we can't perform such complicated procedures ourselves. That's why consenting is not our job. So what we are going to do, ask that he consent the patient with the acute scrotum as soon as the emergency case is finished. Okay. B is ask the registrar to contact the consultant at home. Phone the medical registrar on call. Attempt to take consent as well as you are able to. Okay. Ask a surgical SHO who has performed the operation in the past to take the consent. Okay. So the best and the worst are quite clear here. A is the best one. Like we are telling him that ask that he consent the patient with the acute scrotum as soon as emergency case is finished. Okay, so in this we are telling him that he consent because he is going to perform the procedure and he should consent. So that's why A is the best one. And as I told you that we as a pan are not supposed to consent such complex cases. So in D, attempt to take consent as well as you are able to. So this is obviously wrong. We can't consent. So A and T are quite clear here. The next ones are B, C, and D. So among these, E is the better one. In this, a surgical SHO is already in the team and has performed the procedure, so he is the next person to contact for consent. Okay, so this is also right. And the other ones are B, C. Among B, C, B is best. Ask the registrar to contact the consultant at home, and C is phone the medical consultant at on call. Okay,
Yeah,
medical registrar on call. Okay,
medical registrar has nothing to do with any surgery, right?
yeah, yeah, yeah. That's why.